And welcome to the Esc Tv. My name's Dr. Gale from Leeds, United Kingdom, and I'm here with Professor Bongiorni from Pisa, Italy, and we're talking about the exciting development of the Electra registry, a multi-country, multinational registry looking at lead extractions. So, Professor Bongiorni, tell me about the implications of this exciting initiative.
The implication is really very important in clinical practice, and will be important in clinical practice because if you consider that indication to lead removal is mainly infective and non-infective. There are a lot of patients with local infection that are treated conservatively with a lot of reintervention without a real cure of the problem, because the local infection must be cured only with the complete removal of the device, lead and pacemaker or defibrillator. And the risk of this procedure, the risk of major complication in my opinion, is the real concern about the indication of this procedure. Physicians do not refer patient for lead extraction because this concern about lead extraction complication. And another point is that we have a lot of patients with multiple leads, abandoned leads, not functioning leads, because of concern about complication. So Electra is very important because demonstrating that complications are not so frequent, and the success rate is so high, that could change the indication in the future in the community.
And so we have an increasing prevalence of leads because of an increasing prevalence of pacemakers, and therefore potentially an increased prevalence or need for lead extraction for the various reasons as you've detailed. How are we going forward? How are we going to develop this service?
Yes, I can imagine in the future with the need to add leads, for example, for resynchronization therapy. We can find patients with abandoned lead because we have to insert new leads for resynchronization therapy. Or I can imagine with the possibility to use this new technology like MRI conditional devices. They cannot be used because patients had old leads not compatible with the MRI. So I think in the future there is a need for lead extraction activity, and it is important that countries have a good program on this topic. And in my opinion, several key points are important. The volume of the center, because I think that Electra will demonstrate that there is a difference between high volume and low volume centers, and there is the need of some facilities, and some important facilities like the surgeon, for example, the need of a surgical standby to treat immediately some complication, because complication is possible, but the complication must be cured in time to save the patient.
Good. Well, thank you very much. So I look forward to hearing more about the Electra registry. A great initiative, and thank you very much, Professor Bongiorni.
Thank you.